So we're at University Hospital Coventry and Warwickshire Trust in Coventry, working with the Trust to figure out the next best steps to use drones for medical delivery in the UK. We're doing some design thinking workshops over a period of 3 days with some key individuals at the Trust and at Skyfarer to really figure out the best way forward of interaction and use cases for medical delivery.
I think there are a lot of use cases that actually are applicable to this technology. I'm a pathologist, so actually we deal with blood samples that come from people, and frankly we want to get the blood sample from the person into the laboratory as quick as possible. This technology allows us to actually bridge that gap between the individual blood being taken to when it's analysed, and that's a really important element that we could actually do some work with Skyfarer.
So one of the difficulties that we've had to overcome is that the hospital's processes are very complex, and there's a number of different services that they offer to patients. So we've had to go into a deep dive into the service and how to make it as easy as possible and as seamless as possible for them to interact with us.
So I think UHCW and Skyfarer are very much aligned in terms of our values and our ambitions. So we're both very innovative. Skyfarer talk about being altruistic for society, and again UHCW, we are there to support our local population, to be there for our local community, to be the best provider and to be world leaders in our provision of healthcare, as well as innovating and pushing the boundaries of healthcare as well.
We constantly strive to be better tomorrow for our patients than we are today. And we're always looking for innovations to help us on that. I'm really excited that Skyfarer are literally on our doorstep here in Coventry and Warwickshire. We have lots of links with them and their colleagues across Coventry University as one of our key strategic partners, certainly around the innovation and research agenda. We want to be part of that infrastructure, that architecture here in Coventry and Warwickshire to lead innovation, to lead the NHS alongside Skyfarer.
The key message here is that there is no rule book to follow. No one has done this before. No one has done routine or emergency ad hoc medical delivery in a hub-centric network for an NHS Trust in the UK. So we have to start from a blank sheet of paper, and we've been very fortunate to get the backing and support of UHCW Trust in Coventry and the key individuals and stakeholders to really formulate this plan going forwards on how do we make drone delivery possible for the benefit of society and patients and healthcare for the UK, and really try and set a precedent for how we do this for the rest of the nation, starting with the blueprint in the West Midlands and Coventry, and then potentially growing that out and setting a standard. So this has been an exciting start to what I'm sure is going to be an exciting future for drone delivery of medical supplies in the UK.